It is very important to avoid conditions which cause infertility, at least the avoidable ones. In your lifestyle, if smoking is there, it has to be decreased or eliminated completely. Obesity is another cause of infertility. Hello, I am Dr Surveen Ghumman Sindhu, Senior Director and Head at the IVF unit at Max Panchsheel Park and Saket. It is very important to avoid conditions which cause infertility, at least the avoidable ones. One of the most important ones is age. So my advice would be that in order to avoid infertility, have children at an optimum age. Maybe not young age, but an optimum age. So the egg reserve starts going down after the age of 35. So we should complete our families before the age of 35. Besides that, a good sleep is very important for ovulation as well as for a good spermatogenesis, that is a good sperm production and good quality of sperm. A diet rich in oxidants also does the same thing. It improves the quality of the gametes, that is the egg and the sperm. Smoking must be avoided because smoking can cause DNA damage in the sperm and it can cause premature aging of the ovary. So in your lifestyle, if smoking is there, it has to be decreased or eliminated completely. Besides that, obesity is another cause of infertility, both male and female. In females, it causes a lack of ovulation, that is the egg is not released, and in the males, it impacts the spermatogenesis. It is good to do regular exercise. Yoga is very beneficial and there are scientific studies on yoga which have shown that regular yoga improves the sperm count. In today's world, we have a lot of endocrine disruptors which we have to be aware of. That is, plastics, coating of paint, pollutants, pesticides, they all impact the reproductive system and they impact the egg reserve in the woman and the spermatogenesis in the man. So it is very important to avoid all these. If we take steps and measures to make sure that we have an optimum health, we would be able to avoid the avoidable causes of infertility.